and welcome to Alzheimer Speaks Radio. I'm your host, Lori LeBay, and I'm so excited that you're joining us today. We are going to have a fascinating conversation as usual as we learn from people all around the world at all ages and stages of life. Stay tuned as we shift our dementia care from crisis to comfort.
Here we go. What you think about, you will bring about dementia change. We will.
Well, hi, everyone, and welcome to Alzheimer Speaks Radio. Today, we're going to be talking about fall prevention when it comes to cognitive decline. And this is such an important topic and so often overlooked. You know, when you get a diagnosis, you're really not thinking about falling, thinking about so many other things. Today, we're going to have a wonderful conversation with Dr. Shawn Weiss, who is just filled with knowledge, and I know you're going to enjoy this conversation because she's just wonderful to talk to. And also, I wanted to mention that June is Alzheimer's Brain Awareness Month. Some of you might not have been fully aware of that. There are so many things that come out during the year, so you're going to see a lot more education this month than some others. And before I get started, I always like to do a couple of shout outs. First, I encourage everyone to just take a peek at alzheimerspeaks.com. Check out all of our free educational resources. There you'll find information about Dementia Map, our global resource directory, and Betty the Bald Chicken, Lessons on How to Care, which is a wonderful children's book, but really it works for all ages and all situations when you don't feel like you fit in. Last, I want to give a shout out to Twiddle. Twiddle has some great sensory products. So if you are dealing with someone who has some anxiety, gets a little fidgety, they also have a product called AdaptWrap that is wonderful. If somebody doesn't have mobility to lift their hands over their head, or dressing just gets a little combative. So go to the number 4 and then twiddles.com. That's 4twiddles.com. Dr. Shawn Weiss, I am so excited to have you with us today. And, we've been chatting on and offline, and I've been kind of perusing your websites, and you're really doing some cool stuff. So I'm going to have you, if you don't mind, introduce yourself, please.
Oh, thank you, Lori, for having me. It's an honor to be here. I'm super excited to talk to you. Again, my name is Shawn Weiss. I have been a physical therapist for, over 26 years now. 20 of those years have been spent in senior care. Also, 20 of those years have been spent owning a skilled home health agency in the Columbus, Ohio region. Also have a consulting company called Senior Health and Wellness Group, where I do a lot of my education and in services. It's pretty easy to tell, like my first degree, my undergrad degree is in education. So knowledge is power. I feel like I teach every day, right? Even with my clients. So I love doing these types of things. I think that, health is wealth. So I'm always trying to spread the word. I'm also a certified fall prevention specialist and was published in that area back when I got my doctorate degree, fall prevention and assisted living with cognitive impairment, and a certified dementia practitioner. So over 26 years, I've had lots of little, initials put behind my name. But most important thing, I think, is just being able to adapt and serve seniors as they age. And that's kind of where my passion is.
Fantastic. Well, I'm excited to have our conversation because we're actually going to be talking about fall prevention, and massive area that more people need to be educated on. But first, I always like to get a little background on yourself. And have you been personally touched in your own family or circle of friends by dementia?
Absolutely. My great-grandmother passed from dementia and the complications due to dementia. And, it's always, I feel touches the families, so hard, and each in a different way. Right. And I think being in the healthcare profession has, afforded me the ability to assist with that when that happened. And also had a grandmother that was very dear to me as well, pass in 2016, and was starting to have memory issues as well. So it's difficult. In the 26 years of practicing and 20 years having home health agency, thousands of patients that we deal with on a daily basis. 80% of our clients have cognitive impairment. So it's something that touches us deeply and the caregivers that I employ. And it's the top priority for us when it comes to helping families navigate that.
Well, and I know in the healthcare industry, it's talked about a lot, but I don't think families really hear all the conversations. They don't see all of the articles. So can you give us a little background?
Well, I can tell you, it's kind of epidemic proportions. I mean, the amount of falls have increased significantly. And yeah, I mean, the population over 65 is increasing. So that does account for some of the increase in numbers. But, the stats are right now 1 out of 4 individuals in the US fall over 65 every single year. They say half aren't reported. So I don't know if that number is actually more staggering. They say half aren't reported, but like, how do you know half aren't reported if they're not reported? But I get the concept when they report that statistic, and that is people don't want to tell somebody that they fell. So that, you have to always kind of assume that that's a lower end, the number that they're giving. There were 3 million emergency room visits last year, simply due to falls and fall-related injuries. The healthcare system is spending over $50 billion a year on fall-related injuries. And it's staggering. And we see that especially in those who have cognitive impairment, those numbers are increasing, especially in senior communities. It's a 72% now of assisted living residents have some sort of diagnosed cognitive impairment. And that might be, from mild cognitive impairment all the way through maybe the stages of Alzheimer's, Lewy body, it kind of lumps them all together. But 7 out of 10 residents in those senior communities have some type of issue with memory.
See, that whole memory issue doesn't surprise me, because for years, people in all realms have said that 80% of their population has some cognitive decline. And when you talked about the falls, that probably only half, we know about, I would say that is very low.
I agree.
I look at some neighbors and some friends, and they're not going to the doctor. They're not reporting this to nobody, because they don't give up their independence. They don't want people looking at them cockeyed. And even my own parents, I'll never forget when my mom fell going outside, and it was winter. And my mom had dementia, and my dad couldn't get her up. My dad was in a weakened state because he was getting chemo and stuff for his cancer. And so here my mom is like laying on this slab of ice outside.
Oh my gosh.
All the neighbors have gone south, so there's nobody to call. You can't really go in the house because she has no concept of time. And so even if he's gone for 30 seconds, she's going to think it's 30 minutes, and that she would get really frightened. So he goes in the garage, and he's looking at trying to figure out how to get her off this slab of ice without them both going kerplunk and freezing to death.
Oh my God.
Some sand and salt, and he's sprinkling it around her like she's a tire and going to get traction. That didn't work. And he's telling her to get on her knees, and she's like, okay. I mean, literally, that's what she would do, because she didn't know what that meant. So he went back in the garage, and he's talking to her this whole time so she doesn't get scared. And he finds a little red sled, and he brings that up to her, and he like pushes her on, rolls her onto the sled, and then pulls her up by the cabin again, because the garage was detached. And then to kind of crawl up the steps, and they got in the house and they stayed there. I didn't hear that story till August.
Really?
On a total fluke. When my mom was rubbing her knee, and I'm like, well, what's that all about? She's like, oh, and for whatever reason, my mom remembered that.
Remembered it.
And she said, oh, I fell this winter. I'm like, I talk to you 3 and 4 times a day. They were like 2 hours away from me. Not a word. And then my dad tells this story, and he's so proud that he got her in.
Problem solved it. Yeah.
Going, oh my gosh.
I know. When you're trying to think, you're trying to visualize that. And I mean, but it's so true. And think about that. That was a traumatic situation that they didn't even report that, right? Yep. And you're right. I think it's definitely underreported. We see it all the time. Yeah, they're not going to tell their son or daughter that they fell.
No.
They're not going to have to give up the car. They're not going to have to go move into an assisted living community. They don't want anybody to know, and they usually find a reason to explain it away, right? Denial, and it's one of the biggest things is the biggest concept is falls are not a normal part of aging. They
Yeah.
are not, and most people are like, oh, I'm just getting older. I just tripped. My mom does the same thing, and she's cognitively intact, but she is going through chemo and has neuropathy. And we just had this conversation last week. She's probably listening, so hi, mom. But she didn't have her walker with her, and she didn't have her pendant on because my dad is usually there, and she fell, and she's like, well, it's the oxygen cord, and it was fine. I said, but you didn't have your walker, you didn't have your pendant, right? So, so many things. But, and again, I heard about that, a week or so later.
Yeah. If they're not hurt, and they don't have to call, and if
Yep.
they can get up, on their own, and
Yep.
sometimes that's even getting up on their own is calling the fire department, but they still don't think it's reporting because it's the fire department. It's not the doctor.
Well, they're going to find out. I mean, there's many, and especially in Ohio, I know of 3 different communities now that are incorporating their EMS services into the Fall Prevention Coalition, to where they are now taking a more active role on those repeat fallers. Because once you've had one fall, the statistics shows it doubles. If you've just had one fall, your risk for falling again doubles. So that's staggering. And it's going to come back and bite you at some point, right? If you don't do something about it, for sure.
Oh my gosh. I mean, we could share stories back and forth about the manipulation of not telling, and in the recovery period, the whole process
Right.
of being able to no, I'm okay, or I can get up once I fall,
Yeah.
like you
Or
said.
it was a fluke, right? It was a fluke.
Yeah.
I wasn't paying attention. I know I always looking this way and, miss the rug, and also speak about the people that have the, the beautiful rugs in the bathroom that match the shower curtain, that match the towels. And, I could say until I'm blue in the face to lift those up. They're a tripping hazard, especially if you have an assistive device, and they're not going to do it. Right. Yeah. They're not going to tell you. They're like, oh yeah, I do that. And you come in, no, they did it. Happens all the time. All
Yeah.
the time.
Oh, the tripping hazards. I used to sell real estate, and that was one of my big things was, okay, all the throw rugs, they're out of here. Come on. If you really want to stay independent, living in your house, then you have to help this process along because,
Yeah.
oh my gosh, those are horrible, or the bad lighting and stuff. So let's get into why people fall, because I'm sure sometimes there can be medical issues, but sometimes it can be environmental as well.
Right. I think the easiest way when I'm talking, even with families or patients and trying to develop a plan, is really breaking it down into 2 areas. Like you said, extrinsic factors, which are your environmental factors, and intrinsic factors, which are a little bit more difficult to control. And that's where your medications fall into those, et cetera. But extrinsic factors are the easiest things to make a difference with. You can just make little tweaks and reduce fall risk. So I think you mentioned a minute ago, lighting. Lighting is a big risk in the environment. I still walk into a lot of really dark homes, and more so you worry at night. If somebody's getting up frequently to go to the bathroom, you want to make sure that they have their pathways well lit. That could just be a motion light. Now you can just very inexpensively buy the motion lights and put them between your bed and your bathroom, or in the bathroom once you walk in there. Super important. Some communities have restrictions on what kind of lighting you can put in your apartment, but the light bulbs, look at the wattage, open up the curtains during the day, all of those things, because the lighting comes into play because typically our vision is going downhill, right? Whether that's, just normal age-related vision changes or macular degeneration, glaucoma, cataracts. One of the first things we ask people was, when's the last time they went to the eye doctor? And sometimes that's, when families are trying to deal with all the changes that are going on, that's sometimes down on the bottom of the list. Well, they haven't had their prescription changed in 2 or 3 years. That's the first thing we recommend. So vision and lighting are huge. if your depth perception is off, if your glasses are just a little bit off from a prescription standpoint, that's going to make a huge difference in noticing obstacles in your path, and in changes of height, from one room to the other, carpet to tile, lips, all this, the separation between rooms. That is frequently the cause. And you'd be surprised at how many times I ask and they don't know the answer to when they had their eyes checked last. So that's huge on our list. And in home health, that's one of the first things we ask on the very first day and if you haven't had your eyes checked in the last year, it'd be the first thing we recommend, because that's going to make a huge difference.
Oh, it really does. I know with my mom, she got to the point, and nobody knew this because she was still, we thought, reading the paper, but she wasn't reading the paper. She was following a habit of holding the paper and looking like she was reading the paper, but she couldn't see. And we found that out when we went to the eye doctor, and she couldn't recognize any of the letters. So then we went to kind of a kids menu with pictures of animals and things like that. And that worked for a couple of years. Then after a while, that didn't work either. But nobody knew that until she went to the doctor. You had talked about, the lighting of the pathways, but the pathways themselves, guys,
there you go.
important too.
Next on the list, yes, is making sure that, everywhere that you access in the home has to have a clear path and the clutter removed. You have to be able to safely, with or without an assisted device, get from the living room to the kitchen to the bedroom to the bathroom, and to exit the home safely. So removing clutter, removing obstacles, throw rugs, cords, etc., is also, one of the things that people overlook when why people fall. That's huge. And other extrinsic factors, you have clothing is one of the biggest things as therapists that we look at. So we'll start with clothing, as in, let's talk about the length of your pant legs. Okay, simple thing. Maybe mom's lost weight, maybe dad's lost weight. They need a belt, they don't have a belt, so their pants are frequently falling down, which is meaning that their hem is going to be touching the floor, and they will trip over their own clothing.
Oh, in style, hanging around.
Yes.
They're not holding them up,
No free shows on, Tuesdays, no free shows. But they don't have a belt and they don't realize that. Or I've had people where I'm like, we take a walk and I'm holding their pants up. And I'm like, do you have a belt? And it's like, they've lost weight, right? So that's something that, you don't even think about. And then the second one is shoes. And especially those who have edema issues, neuropathy issues. When you're looking at footwear, and you have periods, like maybe you have congestive heart failure on and off, and you do have to monitor the swelling in your feet. Do the shoes fit properly? When is the last time you've had your shoes checked? Size-wise, maybe you had your shoes before you started having swelling issues, and now they're kind of binding, right? And they're rubbing the pressure areas, but that will in turn cause you to trip. Just as if your edema went down and you have these shoes that are too big, you're typically going to catch your toe when you're walking. So looking at shoes and looking at the length of pant legs is super important. I've had 85-year-old women who will fight me on the heels. And I'm not going to win. I'm not going to win that battle, right? They have, they're going to wear them, and they're going to wear them even if it's only an inch. They're going to wear them despite my protest. So sometimes you will have that, but we try our best to work with families and encourage them to purchase the right type of footwear, especially in the winter time. If they live somewhere where there is snow and ice, you have to have different shoes for different seasons.
I've always heard, tennis shoes are more comfortable and they're more sturdy. But again, you can get into the laces, and if they're not tied, those are tripping hazards. And people used to joke about Velcro. Now everybody likes the Velcro and just slip into.
I know, aren't they great? Everyone's like, I don't want the Velcro. Now we're like, wow, this is amazing. I didn't want my little kids to have Velcro, right? Because I'm like, want them to learn how to tie the shoe. Well, you can't have Velcro.
Yep.
Gotta learn to tie your shoe.
But it's kind of like they don't write cursive anymore. That's obsolete. I mean, it's like some of these things are, that's
It's like,
the way
what's
to
the
go.
easiest thing that we can do, right?
Yeah.
No, but that's true.
And then with pants, you had mentioned, walking and actually holding somebody's pants up. And I've done that myself. And I think sometimes they don't do the belts because they don't have the fine motor skills to loop it through. So maybe it's suspenders to hold the pants up in place. That's a little bit easier for some because they can be attached and then they just have to.
That's so, so true. That's an excellent point. And depending on whether you're living like in your own home or if you're in a senior community where somebody might, notice that, right? And call the daughter, or let's try to do an intervention to get that under control, especially if they've fallen once. Our goal is big of, as a therapist. Yeah, I mean, if you've fallen and you've injured yourself, we're experts of that type of thing, but we're also experts in prevention. So we want to notice these things right off the bat, to put things in place. And clothing is an easy item to remedy, in my estimation. So the other thing with extrinsic factors, we talked about the environment, and we get fought on this quite a bit too, is the appropriate use of assistive devices. And the not wanting to use them, fighting to use them. And usually once I explain in such a way that, hey, it's actually improving your independence. It's actually lowering your risk for falling. It's actually improving your gait and walking pattern. That's going and helps your posture. So it allows you to do more things independently. And then sometimes that takes a while. But when you're dealing with somebody who has cognitive impairment, some of these fall prevention measures just kind of go out the window. I mean, they really do. I mean, you're not going to tell them to remember their walker every time they get up. They're not going to remember their walker. They're not going to have it with them. It doesn't matter how many times you tell them, right? Sometimes signage works. We've put signs in where somebody's like by the recliner, and maybe they'll see, get your walker before you get up, if they can get that, if they can comprehend that. But a huge problem with assistive devices, that's for sure.
Well, one of the things that I noticed, again, this goes back to my 25 years of selling in senior housing. I was shocked at how many seniors stigmatize those they feel are too old to be living in their building because they're making them look bad. I mean, it was just like, I'm not moving in that building because they're too old. They're the same age, but because they had a walker, they had a wheelchair, they had a cane,
it's all over.
Any of those things, it was like, wow. That really took me back because I thought if anyone would be understanding, but there's such fear in the stigmatization out there, and they've fed into it.
They feel like they might as well just write me off if I have to have a walker,
Yep.
Write me off. I'm done. I'm not doing it. And we have it brings my into mind one of the communities that, gosh, I've been taking care of residents in that community for 19 years. They have an independent portion and a assisted living portion. And I do lots of health chats, and, we do equipment checks and all these safety things. And it's funny because I have to split them up because they said, well, I don't want to go over to the big house. They call it the big house. Like, funniest thing, it's like high school. Like, they just know they're not going to mingle at happy hour. They want their own happy hour, right? It's like, yeah, which you see that. And, it's hard. You're right. There is a stigma. And somebody has to transition into a community. I mean, it's traumatic experience. It really, really is. And it takes some adjustment, but, and you have to get past, and change their mindset. That's the biggest thing. And if there's cognitive impairment involved, that's a whole other, you have a whole other layer of complexity involved with that.
Yeah. Well, I want to talk about, I mean, we've given a lot of reasons why people fall, but there are, there's a whole other thing. We've been talking about walking, but people don't realize how often they fall when they go to like place their butt in a chair and they miss. And that happens a lot too. Why does that happen?
Well, I think it's, from a balance standpoint it's really a sensory thing. One of the most dangerous things you can do is, whether or not you're using an assistive device or not, is backing up. I mean, if I had to walk backwards now, I might have more difficulty than I did 10 years ago, right? It's hard, and you misjudge. And then whether that is a depth perception type of misjudgment, or you're not paying attention to what you're doing. We always tell people, you should always come up to the surface that you want to sit down on, then turn, feel your legs against the surface, and reach back. If you don't have something to reach back on and you're 85, which I mean, you probably should be sitting in that chair anyway, right? You want to try to promote things that they could push up from, but always promote reaching back so that they have to look to see where they are and feel the back of their legs against that. But that happens all the time. They'll just come in, they plop.
Yep.
And if they don't have that control, it's, eccentric control of, for instance, the quadricep muscles, which are the muscles on the top of your thigh. If you are weak and you don't have that good lowering control and you plop, and if you miss, the risk of injuring yourself is much greater, right?
Yeah. Or people might back up and they have one leg that feels the chair, but the other half doesn't. And so if there's not, that's why I always like arms on a chair for the older population, because it's real easy for them to, get part of a cheek on a chair and 3/4 of it's off, and well, they're going to go where the 3/4.
Chances are they might get in there. Yeah, they have a higher chance of hitting it than coming off the side of it. You're exactly right. So they shouldn't be sitting in armless chairs, more than likely. And then also the seating surfaces, that matters too. And when we do home assessments all the time, and one of the things we're looking at is the height of the chairs. It might be their favorite chair and they don't want to give it up, or it moves, and getting up out of it is becoming increasingly difficult. And that's a fall hazard.
The cushions that slides,
Yep.
I see that too, and that I see that more with our elders.
Or those deep chairs, those deep sofas, and you just can't get out of them. But you're going to try to get out of them, and you end up maybe falling forward or coming down onto your knees. That happens quite frequently too. Yeah, so surface is huge.
That's a really good point in terms of those deep couches and falling forward. I think that's something that a lot of people don't think of,
And you can get those risers, and sometimes if they really love they don't want to get rid of it, they can't afford to buy something else. And you can get the risers and put, just like you would beds, you can put sofas on risers that might, boost them up another 4 or 5 inches if that does the trick, So we always try to do those types of modifications first before replacing or forbidding people to sit where they want to sit, right? But it's a huge fall risk, and we're trying to, as physical therapists, we do a good job at preventive falls, but we're not going to do everything. It takes a village, it definitely does when you have cognitive impairment.
Well, and if it's a really deep couch, you can have pillows back there, so you're not falling back so far too. That there's so many things, but you don't know them if you don't have the conversation, if you're not being honest. And again, these are really common issues that so many people have. It shouldn't be anything that anyone is embarrassed or ashamed of. Most of us get weaker as we're older compared to what we were when we were younger and stuff. But again, there's things that we can do to help change that as well.
Well, you see now, Lori, that, there has been a big push, and I've seen a lot of improvement from like a national standpoint, really kind of a worldwide standpoint, where you see a lot of evidence-based community fall prevention programs that are geared for people, 50 and over. Like you need to start now, right? Prevention is the key. And they have wonderful evidence-based programs like, that you can go attend at maybe the senior center or the local community center, like Matter of Balance or Stepping On. National Council of Aging, National Department of Aging, CDC. They actually have some really good free information on basic fall prevention strategies for community dwelling individuals over like 50 years old. I think the issue that I see is that once, they, get older and they've already fallen, it's just the more frail elderly, those who have cognitive impairment, where their risk is much higher. That's where we're seeing, really the data. So, trust me, I'm all about prevention and wellness. There's some wonderful programs, but for instance, some of those community programs, if you use an assistive device, you're excluded from attending. If you have any documented cognitive impairment, you're excluded from attending. So then you start having to look at, okay, well, I don't want to wait for something bad to happen, right? I want to prevent, bad things from happening. So then there's, a push, like I'm on the Ohio Fall Coalition, and really pushing to look and include more assisted living communities, skilled nursing facilities, things of where these are the people who are ending up in the hospital repeatedly. Yeah. And what's being done about it. I used to do a talk called it was like fall prevention, like beyond the incident reports, right? If you have a loved one that is maybe living in assisted living right now, and it's I did this nationwide. I mean, they're notorious for, if somebody falls and they didn't hurt themselves, so they didn't have to go out by squad, and I asked to see the incident report, and the intervention was reminded patient to use call light, reminded patient to use their assistive device, and that's where it stopped. And that just isn't going to cut it. And when you have cognitive impairment, like I said, a lot of those things get thrown out the window just because of that. So we've got to, kind of shift to making sure we are looking at these people who are having repeated issues, and why are we not making those adjustments? Exercise and therapy is fantastic. We're going to make some leadway with that, but that's not all of it. It takes a lot more than that. It takes a multidisciplinary approach for somebody.
The other thing I wanted to talk about, and I love that you're mentioning all these different programs, and like with Medicare and stuff, a lot of them have the silver sneakers programs and things like that people can participate in. And there's a lot of stuff that's available even on YouTube for them to follow if they don't want to leave their house, as far as exercise program and strength building and stuff. But one of the things I don't think people understand is how the depth perception can change with color. Not always just texture, but the whole color. And can you talk a little bit about that? I know I didn't really know that until I got into the whole senior, movement and healthcare. And it's like, oh, that's why the black's by the elevator, because they think it's a hole and they're trying to keep residents from
going
in the elevator, or around the nurses' desks and things like that. Can you speak to that at all?
Yeah, my experience with that, and there's some great, gosh, we have so many communities popping up around my area that are so wonderfully designed with that in mind. And really for the fact of kind of emotional wellness, right? And kind of preventing, issues with sundowners and things like that. They use the light greens, and the toilets are green. Like, just, they've really implemented those types of things that are really they're soothing in nature, because, as like as the disease progresses, you're going to see personality changes. You might see irritability, you might see paranoia, you might see aggression. And a lot of the colors that they're using in senior communities as they get built are to minimize those types of things. They try to stay away from the reds, in terms of that is more agitating. I don't have a lot of experience in the colors, other than the fact that the greens I see all of the time now. And like I said, even the appliances and the toilets are colored that way, really for, I think, emotional issues.
Yeah. Overseas, they still use a lot of the red. They use the fixtures, and they raise their light fixtures. So I shouldn't say raise. Some of them they lower. In a wheelchair, they're easier to access, but they're easier to find. Because one of the problems that I have found and have learned over the years is that, the calming colors are nice, but as our eyes age, we don't do good with pastels. They blend in from one thing to another. And so those primary colors can really make a difference. Those reds or blues can really stand out.
And I see those often too on surface changes, to make sure that it's easy to spot when they, so it's not an obstacle when they're changing from maybe carpet to tile or room to room, where they'll use those colors for that too. Really important.
A couple other things that I'll just point out. Again, this is from my own personal experience, and I didn't know what the heck they were originally. But my mom used to tap her toe when she was walking. So we'd be walking arm in arm or hand in hand. And when we went from like asphalt to concrete or concrete to grass, her toe was tap, 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 tap out front. And I'm like, what is with the tapping? And I didn't know that it was her depth perception because the color changed. And so she was checking, this is still something solid to be able to walk. And then with my dad, I'll never forget, and I never knew he was having problems either. And, he didn't have dementia, but he had brain cancer. But he didn't seem to have any cognitive issues. And we were having a party at our house, and I'm like, Dad, can you pull your car up closer to the garage? And he's like, oh, yeah, fine. So he goes and does it. I look out the window. I'm like, my God, you're 15 feet away from the garage door. That isn't that close. But he's like, what are you talking about? I'm going to go through the garage door. That was his like, give me your keys. We got to get a few more years to the driveway.
It's a whole other topic, right? Is the keys.
But sometimes I think we brush over those things, not really realizing how important it is for us to pay attention, because they are such pivotal pieces to this fall prevention.
And it's taken the time, and as a healthcare provider, the nurses and therapists that we have on staff, it's one of our primary objectives is educating the family. Because, as a provider, how many hours am I actually with our client versus how many hours I'm not with them. So we want to set them up for success, whatever setting that they're in. If they're in their own home, still living by themselves, or if they're living with a daughter or a son, or if they're in a community, our job is to set them up for success. And when you're dealing with somebody who's at risk for falling, and then they have cognitive impairment, so you've just increased their risk because, gosh, they no longer can recall instructions, right? They're not going to recall what you're saying, and they're also not going to have good safety judgment. So those are the two biggest reasons why we need to educate, families of the importance of starting to make modifications now and starting to intervene now, versus when, it's too late. Because once that first fall happens, like I said, then you're going to have such a higher risk for that happening again.
Well, and sometimes personally, we have to really stay in check of what is our pace of walking if we're walking with an elder. Because if we're walking real fast and they're trying to keep up with us and they're not steady, we could really be causing that issue, because they want to feel independent. They want to feel, in the group. And I've seen so many people, I don't care if I'm at the mall, the grocery store, wherever, where I can see somebody is really trying to catch up. And what a horrible feeling for them to feel like they're behind. You can see that their mind is just kind of spinning. And some of them get almost out of breath. They could have some other health issues and stuff in there too. So I think we have to be very cognizant of how are we behaving. We accommodating their pace instead of trying to pull them up to our fast pace because we're in a hurry. I think that's really, I think we do that with everybody.
It's like instinctual now for me. Like I'll just stop and go help, right? Because you see it happening, whether it's, a spouse is walking ahead or a family member, and you have, and you think about that too, because you'll see that, and you'll see them get a sense of rush. They'll get frustrated and want to keep up, and maybe they don't have an assisted device. Maybe they need an assisted device. Maybe they have Parkinson's. Maybe, for whatever reason, why they have to have a slower gait speed. That's such a thing that's easily prevented. And like I said, it's those little things that somebody has to point out that makes a world of difference. Huge difference.
Huge difference. We're going to take a real quick break and hear from Q Blocks. But if you're just tuned in, we are talking with Dr. Shawn, and this has just been a wonderful conversation regarding fall prevention, giving us insights, why and how it happens, how we can prevent it. And you can always go to her website. She's actually got a couple of them, all in the show notes, along with her email address as well. And we'll be right back and carry on this conversation.
I also want to introduce you all to Q Blocks. They have been absolutely excellent to deal with. They have been in business for 18 years and they serve the globe. I can't say enough good things about this company. I've had a lot of bad experiences. I don't know about you with tech companies. They have made a very complicated process very easy. And their staff is so kind, so polite, so respectful to work with. And, you know, when I am frustrated and ready to pull my hair out, they just smile and tell me everything's going to be okay. And they really are just on top of the communication, which alleviates so much stress as an owner when you're dealing with tech issues. You can get a 10% discount. Visit them at Q Blocks, that's CUEBLOCKS.com, or you can email them at letstalk@qblocks.com. For that 10% discount, just put Lori, Lori, in the inquiry form. And again, I don't think you'll be disappointed. I surely haven't been. I can't rave enough about this company. And that's kind of rare these days.
One of the things we haven't talked about, we talked about kind of sitting in a chair, but another place where I see people really struggle is getting in and out of a car. And some people are still driving, some people aren't. But either way, it can be a difficult thing as we age. Have you seen that as well, where that, you know, and the type of vehicle makes such a difference, you know, if it's a low rider versus those mid-size or even the small SUVs just seem like they are more adjustable for people to get in and out of than something that's really low that maybe they drove all their lives.
And we do see that quite a bit. And, you know, that's one of the things, you know, having a skilled home health agency, you know, the driving issue is big, right? So if somebody maybe is temporarily not able to go places, you know, we're going to assess them getting in and out of the car. If they're still driving though, you know, what we're looking for is their ability to not only, if they're trying to be independent, right? And we know that they're doing these things on their own several times a week, going to the pharmacy, going to the grocery, their ability to not only open the door, but to turn appropriately and give them strategies, you know, because the whole, you know, getting in and kicking the one leg in and leaning in, not a good idea. We really teach people to kind of turn and sit and then move their legs in. That's just an easy strategy. Even if you are injured, we kind of blanket the same strategy on getting in and out of the car. Yeah, my mom had the same issue. Like I had I don't know if you're familiar with the Volkswagen Atlases. They're cars, but they're up a little bit, just a teeny bit. And she even had trouble getting in and out of that. Now I just went and got a Bronco, and now she's, you know, screwed. So I have to get the running boards, and she won't be able to get in that. But they have a sedan that we take for her. But people will, if you have, you know, I don't know how many 80-year-old, 70-year-old men, they're still trying to drive their pickup trucks. You know, we live in a rural area, so we still have some farmers and things like that we help take care of, and they still go into the truck, and I make them show me how they get into the truck, and sometimes it's a complete disaster. And some of those things you're going to control and some of them they're not, you know, so we want to try to make it as safe as possible. And sometimes that's just a matter of strengthening, right? Of getting up into something, but you should always have somebody with you. We always say, especially if there's cognitive impairment involved, do they need to have assistance to leave the home? Then we need to document what that assistance is. Is it somebody needs to kind of have a hand on them when they're getting in and out of the car, or we assess their ability and they're great, they're independent, we have no problem with that. But if there's any level of assistance that we feel is necessary from a safety standpoint, then that's our job to communicate that with, you know, son, daughter, they have a power of attorney, if they have somebody that they're living with, who is responsible for getting them to appointments and things like that. We've got to make that clear. Because, you know, one of the hardest things for us to recommend is taking the keys away. And, you know, we assess all kinds of things for that, like, you know, mobility in general. We're looking at, you know, neck mobility. We're looking at trunk mobility to be able to turn, God forbid, we don't want anybody getting into fender benders. It's happened. And then suddenly the keys get taken away, right? We really don't want them to injure themselves or somebody else. So, lots of factors go into that, but mobility is the biggest one on getting in and out of a vehicle. It should always be assessed. If somebody wants to be independent, it's again, the battles you have to pick, and you have to have these hard conversations sometimes with the families, and we'll call up and say, you need to take the keys, or you have to be with them. And if they can't be with them, and maybe they don't live in the same town, what do you do? So we'll recommend like maybe non-medical agencies that can come out and offer transportation services or something like that.
Yeah. Well, and I think so often people like, well, we had it assessed. And then they think they're done. And it's like, no, this can change anytime at all. I always recommend to families, even if they're just assessing it themselves, not even having a professional, but just checking out, letting them drive you to the grocery store, realizing that if they're having gait issues walking, that could easily affect their driving skills. And just because they haven't had an accident doesn't mean they're not going to have it.
Or reflexes are slower.
Yeah.
I mean, I remember my grandmother, she moved back from Virginia to the actual neighborhood that she lived in for 30 some years. And you could actually throw a rock and hit the old house that she lived in. She was right there. She's so familiar with the area. And the only time she would drive would be go to CVS to pick up her medications. And it started to become an issue when she was still living alone, where if she waited too long to go leave for CVS, the neighborhood is, all the houses look the same. And luckily we had put OnStar in there, and she remembered that, but the poor thing, my heart would break for her. She would, would get dusk and she'd be pulling in the neighborhood and it's getting dark and she could not find her way back to her street. And she would circle the street. Like she would literally be within a block or so of it. And then she would stop and push the OnStar, and they would call my aunt. And that happened so many times. And then we realized that, okay, she probably cannot be doing this anymore if she's not judging time effectively. Mm-hmm. And then with her vision, she's not going to be able to see the signs. And I always felt so bad for her when that happened, because, you could tell it hurt her heart. Yeah. It just hurt her heart to have to admit that she couldn't find her way into a neighborhood that she's lived for 30 some years.
Yeah, well, there's this shaming thing that goes on with people if they have to move out of their house when they're older or give up their driver's license, and it shouldn't be that way, because really, like I said at the beginning, everything we're talking about is helping people be safe and keeping them as independent as possible. And you talk to any young person and they're like, give it to me. I mean, there's like no question. You're going to make my life easier? Give it to me, because I don't want to worry about all those little things. And so I think as a generation's age, it's going to get easier. But for our older elders, it's really tough.
But the baby boomers are fighting it every step of the way. Like they're the ones that, we're going to travel. We want to go do fun things. Like if this is making my life easier, give it to me. Well, yes, I understand. But then you get up into the older generation above that, and it's still like pulling teeth.
No one ever did this before. Well, because it didn't exist before,
Yeah. Technology, we have wonderful things now, right? There's some great things too. That made me think of, and we were talking about walking. I was at a conference last year, and there's some really neat technology coming into play where they will have, and this is, of course, for people that still have that can use their cell phones, right? But heck, all the patients we have in assisted living, I think they all have a cell phone, right? We can put an app on there, right? And what it's doing is it has to be worn in their pocket, so that you have to make sure that happens. But it's tracking their stride length, and it's tracking their skate speed, and it's tracking their continuity of their steps on the app, so that either a caregiver or their therapist or their care provider can log in and pull reports on that, which is trying to predict their risk for falling. So there's some really neat products coming out in that realm that I'm interested to see as the studies come out.
Well, and like you mentioned, even little things like having sensory lights, come on, just plug them into the wall and they'll just light up. They don't have to be on all the time. So many of those things can make such a huge, huge difference. Let's talk about people with dementia. Do we have an increased need to worry about them falling?
Absolutely. And I even think since COVID, and just, when you have somebody who has a diagnosis of some type of dementia, because we know dementia is not a diagnosis in and of itself, but more often than not, there's going to come a time where they are not going to be able to live at home. So the percentage of the people who are actually residing either with a loved one or in a community or maybe even a memory care unit of an assisted living is pretty high. So one of the reasons why, the population, what we've seen in these communities to what I consider epidemic proportions, assisted living communities 20 years ago doesn't look like assisted living communities now. So why? I mean, you have the cognition, rate going up to nearly 74% of all residents. Well, that makes sense. Why? That's probably one of the main reasons they had to move in to a community is for more supervision, more nursing care, more help. So then you also start seeing the fall numbers go up as you see the population with dementia going up. And then what happens is you're not seeing the number of caregivers go up though. So the problem we're having now that we're seeing is that there's just not enough help, not enough nurses aides. So you're not getting the supervision that you should be getting. So that's where, agencies like mine from a home health standpoint come in, where we're trying to fill in the gaps, right? And it's becoming, a huge, huge issue. So when you have somebody in a community, you're not just looking at, oh, let's get them on home health services. You're looking at, let's make sure, okay, because we already know they have poor safety judgment. If they don't, they're going to, because it is going to progress, and they don't recall instructions, right? And one of the biggest things that, one of my big pet peeves is educating communities, especially those with memory care units, of not letting these folks fall through the cracks. We want to get them moving. We want to, all the medical studies show that daily activity reduces sundowners, improves digestion, reduces behavioral issues, improves sleep, improves appetite. So all of those things are critical. And as we look at the fact that since they do have poor safety judgment and they don't recall instructions, people are like, oh, well, they're not going to remember what you told them. Like, why would you even do home? I'm not trying to give them a home program. They're not going to be able to do that. But whether they like it or not, they're going to get stronger. Okay. And if they're getting stronger with just transferring in and out of a chair, if they're getting stronger with getting in and out of the shower, being able to get clothes out of the drawer, if they're less likely to fall, that's the whole goal. So you want to get them moving. But what we're seeing is either refusal of care or lack of education in family members and caregivers, which is what we do a lot of. And because we want them to be prepared as the disease progresses, right? And that's going to change depending on what type of dementia you have. For instance, if you have like a Lewy body diagnosed dementia, we've stepped that up a little bit quicker, right? Quickly our issues are going to be becoming more safety preparedness because that disease progresses much more quickly than the other types of dementia. So we want to make sure that safety things are in place and that the families and the caregivers understand what to look for and how to implement these things to prevent somebody from falling. So I know I'm going around in lots of circles, but so many things come.
There's so much to talk about with all of this. Like I was thinking about if you can touch on, prescriptions and food and hydration. I know all of those things can come into play too with fall prevention. Can you touch on those three things?
Absolutely. So let's talk about medications. So one of the biggest, and again, that's an intrinsic factor. So we did talk about the extrinsic factors, which are the environmental reasons why people fall and the things that you can address. But one of the biggest intrinsic reasons why people fall is medications. So, 68% of those between 60 and 79 take at least one prescription drug. And I would say the majority of our patients have at least 5 to 10. You get into polypharmacy very quickly once you get above 75. Most people are taking multitude of medications, all of which have different interactions, many of which cause dizziness, many of which cause fatigue, tiredness. So that alone is going to increase their risk for falling. But then if you have somebody who maybe is in the middle to late stages of Alzheimer's, maybe they're having aggressive behavior, maybe they're having behavioral issues, then you're going to throw in the benzodiazepines, your Ativans and your Xanaxes, pain pills of anything like that. And that is going to dramatically increase your risk for falling. Because if you're giving that to somebody who's already cognitively impaired, you're going to have a huge risk of them not being steady on their feet, right? Drowsiness, confusion is going to increase. And we have to be very careful with those types of drugs. And a lot of times there's some other things that you can do, and not that those drugs don't have a place, because they certainly do for some people. It's certainly necessary. But there's some behavioral types of things that we can try to modify that maybe lessen the need for those types of medications, right? Nutrition is huge. I talk about and coach on the 6 pillars of health, and that applies to everybody, whether you have cognitive impairment, Alzheimer's, dementia, or don't. You have to look at nutrition. You're looking at stress levels. You're looking at sleep, exercise, gut health, and emotional health. So all of those things are huge. So probably the biggest one of those is sleep. And as you age, and I just did a wonderful talk with Catherine Darley this morning, actually, who's a sleep expert. As you age, our circadian rhythms change too. So sleep-wake cycles are going to change. So making sure that somebody has a routine in place is critical. Suggesting within 30 to 45 minutes, so always of getting up at the same time, going to bed at the same time, making sure that lighting is starting to dim at night to set people up for sleep. Because it could just take one bad night of sleep to affect mood, to affect nutrition, to affect stability, if you're tired. And you think about all the elderly that have chronic sleep issues, right? Or maybe they have sleep apnea, or maybe they have to have a CPAP, or all those things come into play. And if you have somebody who's got cognitive impairment on top of that, they may not be communicating or able to communicate their needs as well as somebody else would, right? So monitoring their sleep is huge. Nutrition and your proper food intake. I'm a huge proponent of not being SAD, not do the standard American diet, which is SAD. Limiting the processed foods, trying to eat more whole foods, increasing protein levels at that age. It's huge for muscle preservation. Muscle is the organ of longevity, and making sure that there is protein of some sort at every meal, whether that's chicken, fish, grass-fed beef, whether that's in supplementation. We have a lot of elderly that might take Booster and Sures, even though there's a lot of sugar. They need that protein in order to preserve their muscle function so that they can maintain their independence. So nutrition, sleep, stress levels. If you are moving environments, if you are having to move mom or dad into a community because of their cognitive issues, that's traumatic. So you're going to have, typically you'll see more behavioral issues early on in the first 6 weeks if somebody's changing environments or having to move out of their home. Maybe they're just moving in with a loved one, but that is a big change of routine. Maybe they're moving into a memory care unit. That is a huge change in routine. That can cause irritation, that can cause agitation, aggressive behavior, withdrawal, depression. And you want to make sure that your individual can communicate those needs. Now, what if you have somebody that can't tell you, right? What kind of observable signs are you looking for in somebody who cannot communicate that? You're looking for withdrawal, refusal to participate in their usual activities, sleeping more, not eating, all of the things. So we want to make sure we're hitting all the pillars of health when we have somebody that's in that situation, because that's going to affect their fall risk. All of it affects their fall risk.
Yeah, well, in the hydration thing, I've had several friends whose parents stopped drinking liquids because they were worried they weren't going to get to the restroom in time. And then all of a sudden they're in the bathroom and they just clunk out, and now they whack their head on the toilet or the tile or the tub, and now they're in the hospital for 2 weeks and maybe broke a hip.
Incontinence is a huge risk for falling. Those who have incontinence, one, because they usually, if they have an urge incontinence and they're just, it hits them and they got to go now, they're rushing to the bathroom. And then you're right. They want to somehow I'm going to limit my fluid intakes. As long as you're doing that within a couple hours of bedtime, which is the time I'm most worried about, is at night, you should be okay. But, having a jug, having something that's labeled, that's filled with water every morning. And I try to say, get that, that should be drank by noon, fill it again, make sure that's drank, is completed by dinner time. And making it very simple and trackable on their fluid intake. And that fluid, it matters what type of fluid, right? Pepsi doesn't count. Diet Coke doesn't count. Coffee doesn't count. Anything with caffeine that's dehydrating, alcohol doesn't count either. Of making sure you're getting, things that are not, too high in sugar content. If you're like me, I hate drinking plain water. I can't stand plain water. I want my water cold, but then I want it to taste like something. So then I'm making sure I have something, usually I'm using one of my nutritional, packets that has low sugar that might have some vitamins in it. I'm killing two birds with one stone that way. And certainly you can do that with somebody that's older too.
Well, and the thing too, when they limit their hydration, then they can increase their factor for maybe getting a UTI or urinary tract infection, which can cause problems, or, the slip and fall, if they have an accident, that is very common as well. A couple other things I want to mention, just because I think they're common, but people don't realize how important they are to fall prevention. One is startling somebody. So being conscious of how loud things are, or even how you approach somebody so that you don't startle. And then so often I saw this, again, going back to my real estate days, people getting on a step stool to get something in a higher cupboard, moving those things down that they need on an even level for them. And so many kids don't understand that because, we don't have a problem reaching and doing all those things. And then the last thing that I thought of that I hear of so often too is those blood pressure swings.
That's called orthostatic hypotension. And when we check for that, typically it's going to be somebody who doesn't really have too many problems, but we find, if they fall, they're falling when they get up, or they're falling, so then we're going to start looking and testing that. So we take their blood pressure sitting at rest. We'll take their blood pressure laying down. Then as soon as they sit up, we take their blood pressures. As soon as they stand up, and we want to see how much it's dropping. And people, it's a significant fall risk. That's so important that you mentioned that. And so that's something that we encourage you to make sure you keep your appointments with your physician. If you certainly are having that problem where you just kind of start feeling lightheaded immediately, you're likely experiencing an orthostatic hypotension issue with your blood pressure. And there are things they can do about that. And falling flat on the floor right beside the bed is not, that's not going to cut it, right? We don't want that to happen. So totally true. But yeah, the UTI, if for those who are listening too, if you have somebody who typically does really well, and then all of a sudden they just start kind of falling, and you're kind of surprised, they started having, they had 2 falls in one day, and you don't remember them having fallen before, at least they haven't told you. One of the quickest things that'll make somebody be more confused and fall is a UTI. And that's usually the first thing that we will test for, is do a urine test immediately. And if they, end up going to the doctor or the ER, that's the first thing they're going to test, is to see if they have a UTI. That will hit somebody very quickly. Same thing with dehydration. One of the quickest things that can put you in the hospital is being dehydrated, and not just in the summer, in the winter too.
Good point. Well, and it's funny when you talk about the UTI. I remember when my mom had her first one, and I thought, no way is this a UTI. Her eyes are rolling back in her head. I mean, it was like she was like over drugged. And they're like, no, Lori, I'm sure that's what it is. And I'm like, well, you test her, and you test her fast, because something's really wrong. And sure, it came back, and I was shocked, because then that opened the door to all these stories of how UTIs look very different in our elders than it does for someone who is younger. And that shocked me. I mean, that just totally, because no one ever talked about that, but it's a simple thing to check and to fix.
Absolutely.
One of the things that I have found, though, too, is that often they will just take their prescription for 7 days, and they won't go in and get rechecked. And it's not all cleared, and then it comes back even stronger. And I always, and again, I'm not a medical professional, so please tell me if I'm wrong, but I always tell people, get your butt back in there and get rechecked when that medication.
Absolutely, because especially if you start a new medication, it takes some time. And you want to make sure that dosage is correct, that it's being used appropriately. And that goes along with the whole, again, we talk about medications, and one of the main reasons why some people end up having to leave their homes is because they're not remembering to take their medications on time, or they're double dosing and they're forgetting, and you need somebody to manage those. Huge fall risk with medication management.
Gosh, I just think you have just been a wealth of information.
I'm all over the place, but hey, it's okay.
So many common things that we overlook, that we don't even know are associated. But that's the thing when it comes to illness. You don't know what you don't know, and don't be embarrassed about it. Just keep learning, and then share what you're learning with others. So I always ask our audience to be a giver of hope. Like, click, and share, not because the numbers mean anything to me, but what really matters to me is getting information to people who need it. And it's easy. It takes seconds. It costs you no time, takes very little energy. And my gosh, you could help somebody avoid a broken hip or worse.
This is so true. It's so true.
And these falls, people might go, oh, she'll just, she sprained her knee or her ankle or whatever. But complications come out of these things so often that people don't realize. Our bodies don't heal like they used to. I mean, I'm going to be 64 or 65 now in June, and my body is very different than what it was when I was 20 and 30 and 40 and even 50 years old.
Yeah, if you fall and break a hip, the stats are clear. 25%, if you're over 65 and you fall and break your hip, 25% of you are not going to come home. That's the statistic, and it's very real. And so, yeah, prevention is the key. Knowledge is power. I have lots of videos on the seniorhealthandwellness.org site on fall prevention, lots of free information. And I agree with you. It's about just getting the information out there in people's hands. The children of those who are over 65, gosh, that generation is going to spend more time taking care of their parents, the sandwich generation, than raising their own kids. So being able to know what you're getting into and what to prepare for, it's half the battle, because you could put things in place much, much sooner.
Well, thank you so much for your time today. Do you want to give a shout out to your 3 websites?
My 3 websites. I know. Isn't that funny? So the seniorhealthandwellness.org is where you will find lots of educational videos of all different topics, especially fall prevention and cognitive impairment related videos. Selecthomecare.net is our home health agency here in Ohio, but there's also lots of wonderful resources on that website for, for instance, Parkinson's disease, Alzheimer's associations, things of that nature that you can find information on as well. And then my coaching practice, which I coach people of all ages, but I have special programs for those over 50, is my Shawn, which I know I have to spell my SHAWN dash Michelle with 1L.com. So you might as well look at it in the link, because I know my mom named me without 2 L's in my Michelle. So Shawn dash Michelle.com. You'll have all kinds of other great information. So lots of opportunity to get some free valuable things.
Well, thank you for your time today. This was so generous and just loaded with just tons of great information. I know I learned a lot from you today. I've been in this field for a long time, but none of us will ever know it all.
That's exactly right.
And we're finding new things all the time, and so it's so important to share that information.
Be lifelong learners is the key. I'm always learning. I learn something new every day too. And that's really important. It's been an honor to be on your show. I really appreciate you having me.
Oh, well, thank you. It takes all of us to make a difference. That's one of the fun things. It takes the scary out too. When you're hearing the same things from different people in different ways and adding tidbits to it. None of us knows when we're going to need this information, but it's about being better prepared, not only for ourselves, but for our loved ones, our friends. Maybe it's a coworker, maybe it's a neighbor. You don't know who's going to need this information, and then you'll say, you know what, I just listened to this podcast.
I just listened to that. Exactly.
Yeah, that happens to me so often, where it just makes it easy, and I feel happy to be able to pass it on, and I can see the relief in people's faces going, oh, thank you. Keep it simple, become part of our group here, and just become a connector. So thanks, everybody. Again, you can always check out alzheimerspeaks.com for more information, or Dementia Map, our global resource directory as well. Till next time, bye now.